Yes, ma'am. All right, here come my countdown. Good evening. We are here for another episode of Sisters Against Kidney Disease. I am your host, Cyrelle, and also your fellow kidney disease warrior. And this evening, I have the honor of sitting down and talking with Eboni Gee. She is not only a nurse, but she's 100% an advocate for kidney disease patients. And she has made it a mission to be a blessing to those of us that's on this journey. So I want you all to just welcome Miss Eboni Gee on this evening. Hello, Miss Eboni.
Hello, sir. How are you? Hello, everyone.
I am well. I am well. Now, Ebony, of course, I can't do your story justice. You're a nurse, but
Yes,
not just a nurse. You're a dialysis nurse, but
yes.
then you're also a dialysis advocate. So just give us a background on yourself, if you don't mind.
No problem. So I started in dialysis in 2001,
Okay.
and I had no idea what it was. I came in for
Right.
my share day, and I was like, "What is this?" But it was, something about it, intrigued me. So, needless to say, of course, I stayed with it, and I just fell in love with it. I fell in love with, just the people. Everybody is like family. You see people 3, 4 times a week
Right.
sometimes for hours at a time. You go through things. You got to tell on people. It's
Right.
all in love, but you get to build those connections with people. So I started as a tech, and I realized I wanted to take it a step further, so I became a nurse. And then I started realizing that that I was having impact on my patients. Like some of them, when they first start, depression is huge, not really knowing how to acclimate yourself to dialysis and how to integrate, what all of these 10 doctors are saying into your one life. And I
Right.
realized like I can help people do that. So I started doing that, of course, as a nurse, but then I realized it just wasn't enough. It's not enough time in a day when you're a nurse and you're taking care of all the patients and you got your meds and you got to call doctors
Right.
and da da da. So I was like, you know what? It's time just for me to try and do my own thing. And so that's what I'm doing now. And I'm like, I want to do it my way, and my way is
Right.
holistically. It's not only about your physical health, it's also about your emotional health, your spiritual health, which support systems you have going on, your intellectual health. How are you, educating yourself about the decisions that's being made for you? So that's, I feel like that's what makes, that's my juge is I'm
Right.
like, it's not just, okay, stick to this restricted diet and come to your treatment. It's a lot more than that. It's still important to go to your grandkids' plays or your kids, whoever you are, and go to those cookouts and go to those weddings. And, it's important to do all of that.
Right. And I think hearing it from the standpoint of a nurse versus a warrior, for me, that's encouraging. What was it that allowed you to bridge the gap? Like, okay, even though I'm a nurse and I'm seeing what they're going through, I know I can make a difference in their lives. What was the turning point for you to shift?
A patient told me, so I had known her before dialysis. And when she walked into our unit, I could just tell like she was probably uncomfortable, maybe a little embarrassed. So I just let her lead it. You know what I mean? Even though I would take
Right.
care of her, it would just be, nurse patient thing. And then, then we got to, just talking about more things. And then, of course, that outside relationship came in, and I just had an opportunity to be real with her because she just wasn't doing what she was supposed to do,
Right.
and she was in and out of the hospital. She was frustrated, and I just had to tell her like, you have to follow what they're telling you. It doesn't feel good or whatever, then you follow it. It doesn't feel good, then you let them know, let them help you change it. But you stopping and starting your meds is not helping. And I
Right.
realized, so after that, and she ended up getting a transplant and everything, but when we were out, because I know her, outside of dialysis, and she told somebody, she was like, she saved my life. And I was like, oh, thank you. I didn't think about it that way because I do it all the time. But it
Right.
was just like that somebody recognized that I made a difference. And I was like, oh, I mean, I knew that, but it was just, that was the it.
Okay, wonderful. Well, thank you for having that heart to do that. Now, you mentioned holistically. What are some of the things that you share with fellow warriors as far as being on this journey and implementing some holistic approaches to this journey?
It's a lot, and usually I start with mindset because I feel like with any of us, and I tell all the dialysis warriors out there, you're still a person. Just because
Right,
you're on dialysis, you're no different than me or anybody else. We all have stress issues in life, frustrations, and we all have to get our mind right first. That's not, that's not. They're not. I always tell you, like, your problems are not more important than mine.
right,
So, we all have that issue. So it's really just getting to the heart of, okay, what is your problem? What is it? And a lot of
right,
times it's not necessarily dialysis or the diet. It's, well, my family likes to go to Five Guys and I love their fries and I can't eat them. So then it's like, okay. So if the potassium is your issue, then it's like reverse engineering. We need to work backwards. What are you eating during the week that maybe you can cut so that you can enjoy this time, with your
right,
family and still feel like you have some control and still feel like you're living your life, but still stay within and I don't call them diet restrictions. I call them dietary preservation because it's about preserving your life. Don't look at it like it's a restriction. You know what I
right,
mean? It's really about preserving your life. So if you just reframe how you're thinking about it, how you're speaking to yourself, that just alone can make you feel better.
right. And you're right. As somebody who's on this journey as a warrior, I think one of the things that's helped me in this past year and a half has been keeping a positive mindset, realizing that I'm more than a kidney disease
Mhm.
diagnosis, that
Mhm.
even though I'm temporarily going to dialysis, that's not the end of my story. You
No.
know, when I was working in ER, I was there for 8, 12 hours a day. So I'm like, I can take 3 hours in this treatment. It's just being intentional about
Mhm.
what I give my energy to. Do I say, okay,
Mhm.
oh, I got to go to dialysis? Or do I say, you know what? Let me get my oil change for the day and be done with it because I got something else to do after this.
Yep.
Now, you said doing your own thing. I know you're a nurse. And let me say thank you for that, right? As somebody who utilizes your services, thank you for being a dialysis nurse. But more so, thank you for having a heart for the patient because, well, not even for the patient, but to see the person that is the
Mhm.
patient. Because a lot
Mhm.
of times you have some techs and nurses who just see a chart, see
Mhm.
the person with them 12 gauge, 14 gauge, and forget that there's a human being attached to those
Mhm.
needles. So thank you for seeing the person. Now, I
Oh,
know you have living with a purpose.
yes.
Um, Tell us what is that? Living with a purpose. What is that?
So living with a purpose is the name of our company, but not only so much the name. It's really like that's the point. Live
Right.
with a purpose. It's not just about existing.
Right.
Even and I hear people say like I'm not like a label, but like dialysis. It's like no, you're not just a dialysis patient. You're still you. You're a person that
Right.
happens to be on dialysis.
Right.
And so I guess I've never really heard people use the term dialysis wellness, and that's why I'm like hashtagging that because I'm like that's what it's about. It's about living well despite being on dialysis, and it's about teaching your
Right.
caregivers and your family members, how to support you in that. And it's also about teaching you how to integrate that successfully into your life so that you can still, get your oil change and go, like you said.
Right.
Like you still have things to do.
Right.
Dialysis doesn't mean you can't take a walk around the block or, cook or go to the
Right.
market or any of that stuff. It doesn't mean that. And a lot of people I think they hear like a sentence, when they come in and it's like, no, you can still do stuff.
Right.
So that's basically what what we do. We're like, no, we're going to show you how to successfully integrate dialysis in your life and continue to live.
Right. And now, of course, when I found out that you were going to be this wonderful guest on the show, I was so excited, just to find out who Ebony was, right? Yes, you are a dialysis nurse, but more than that, you just seem to have such a heart for the person. I went to your website. I looked at Living with a Purpose, and you have care boxes, you
Hmm.
have planners and agendas,
Hmm.
you have things on your website to remind the person, the warrior, that,
Yes.
hey, I'm still me. And I know for myself, when I got my diagnosis, um, the doctor's bedside manners was horrific. I was there by myself, 8 o'clock in the morning, and he just shot it out there. And I remember in that moment, I said, I will never allow another person to be in this position. So I spoke up to the doctor and I said, hey, remember that I'm more than this chart. I'm somebody's mother. I'm someone's daughter. You know, I am more than what you're about to say is going on with my body. And I need that before you step out this room, you don't tell another patient their illness first. You greet them. You talk to them. You don't know the person's mind frame. So you got to be mindful how you handle people.
Yeah.
But looking at your website, and even I looked at your podcast and things like that, you really seem to have your finger on just loving on the person, not the illness, but the person. And how do you stay connected even in the midst of your profession?
I think it's, actually talking, with patients, and I really ask them like all the time on social media, like, what do you want to hear? And even on
Right.
the podcast, I'm always like, I talk about three tips, three takeaways, and it's always like an action plan at the end. Like, okay, so how are you
Right.
going to implement this? What are you going to do? And if you don't know, then go to the contact form on my website, let me know. We can
Right.
chat, and
Right.
like, that's why I wanted to, that's why I created the planner, because I'm like, we always tell people, do this, you need to do this, you need to do that. We're always telling them what to do, why you
Right.
need to do it. But where's the tool to actually implement what you're learning?
Right.
It wasn't there. Or you get a bunch of pieces of paper, and I'm like, no, this planner needs to be the hub. You have, I have a whole month's worth where you can track all your dialysis numbers, your pre-weight, your post-weight, your blood pressure, all those important things. And it's like, because that's what people want to know. That's
Right.
the stuff that you forget. I have an appointment tracker. You go to your appointment, you write the date, you write down what the doctor told you. You're not going to remember probably five doctors down the road what the five doctors up the
Right.
road tell you, you know.
Right.
So you can go to your plan. There you go. They changed this. They decreased this to 20 milligrams of patient tracker in it. It's like that's what people really need. They really need to feel like they have their head around this thing. And I feel like a lot of the patients that I talk to are just so overwhelmed with that actually living, because they're so frustrated with the treatment and what's not going
Right.
right, and this report card and this sad face and this everybody telling you, I'm not doing right and you can't do this and I'm too tired to go here, and it's like, just let's start over.
Right.
let's start over
Right.
let's start over because you can't, it's not just a piece by piece thing. It's, you have to build that foundation and then build up. So, like I said, I just talk to a lot of people. I talk to, like, on my podcast, I'm asking, other fellow nurses and even patients to
Right.
come on and talk to me about, what's going on, so that we can, get the information out there. Like, it doesn't, rocket science. And I felt like there wasn't anything that people can go to. You couldn't point people to anywhere that actually give them that
Right.
lifestyle, information.
Right. Now, from the professional standpoint, how do you utilize that same information, that same zeal to get your colleagues and even the doctors on board? Because sometimes they're so detached from
Mm-hmm.
the person that it becomes almost cookie cut. I know for myself, sometimes the doctor is so busy trying to just make his rounds that he forgets to actually assess me, the person. I
Mm-hmm.
have to stop and be like, hey, talk to me, not at me.
Mm-hmm.
How do
Mm-hmm.
you help motivate your colleagues and even the doctors at your center?
I do, tell them about the experiences that I have with the patients, but I also have to let them know, like, it's almost like reverse engineering with them too. Like, they'll say, such and such isn't taking their medication. And I said, what did you say to them? They
Right.
need to take it. I said, well, did you tell them that, she liked to walk around the track, and if you don't take this medication, you might break your hip or break your knee, and they can't walk around the track. I said, because that's what she
Right.
cares about. She don't care about taking a pill, but she
Right.
cares about the result that she gonna get from taking a pill. But she just doesn't put that result with that benefit, so it doesn't mean anything. and just really breaking it down to, because a lot of times, like you said, they don't know the patient. They're coming around grabbing ankles, listening to the lungs, and
Right.
okay, I'm on my way. You know what I mean? So it's like, no, they don't understand that they pick their granddaughter up from school, and in the springtime and in the fall time they like to go outside, or they don't know those details about
Right.
people. So I feel like as a nurse, we're the nurturers, and it's our job to humanize
Right.
the patient, so that the doctor will be like, oh, okay. I mean, I've been fortunate to work with some good ones that,
Right.
probably know almost as much as I do about, because they
Right.
ask the questions. But for those that have that bedside manner that leaves a little bit to be desired, you just
Right.
gotta, you know, let them know, like, no, this is how they like to be taught. And sometimes it's just like they don't like the way you talk to them. You gotta tell them
Right.
they don't like the way you talk. Like, so you need to fix that. You
Right.
need to fix that.
Right. Now, do you travel to other clinics or facilities to help educate and train with
I
living with a purpose?
I do. So now that's what I have started doing.
Okay.
I go to other centers, and I take little touch bags. So, just some little
Okay.
things I know that I like, in the clinic. Some good hand lotion, some candy,
Nice.
and,
Nice.
just some little, a little something. And I also just take a few, worksheets, or, I have planners, and I can, because what I would really love to do. So I have a Dallas's course that I actually just got copyrighted. It was just approved for
Oh,
copyright a little while ago.
congratulations.
Thank you. Thank you. Yep. It's called the Four Pillars of Dialysis Wellness. So in that we
Okay.
discuss and we start from the beginning to the end. What is dialysis? What are you going to see, in the unit? What do these labs mean? Why are they taking my blood every 2 weeks?
Mhm.
What is the diet about? And then the last pillar is, now how do I bring all of this and make myself fit in it?
Right.
So, because I feel like that is the wave, and like right now I'm a case manager in my 9 to 5, and what I'm seeing is that the integration is just not there.
Right.
Putting that together is not there, and I'm like, I know I can help with that. Like, I know I can bridge that gap for many people. So yep, I
Well,
am on my going all over the place. Like, I'm here. So that's what I'm working on now.
we need to definitely get that out, right? Because I'm in Georgia and I am at a facility where I've seen the high turnover with the techs and the
Hmm.
nurses. And sometimes the quality of care is not up to par. And I realize
Hmm.
for myself, because I am an advocate of being my own healthcare advocate, I'm staying abreast of what it is
Hmm.
that's working best for me. But some of my chairmates are not as in tuned, and
Hmm.
I see how it hurts them in the end.
It does.
So, what you're doing is life changing for somebody
Hmm.
sitting in that
Hmm.
chair. And what do you think is going to take to get that message throughout these clinics?
I know one thing that I also focus on. Before, when I first started, I was like, okay, dialysis wellness, I'm gonna just deal with that. And then I do also talk about kidney health, because a lot of the family
Okay.
members, I've dialyzed generations of families. And I also realized, like, that is an issue as well, so it's
Right.
also about educating the family of the dialysis patient. But not only that, I realized that I'm also committed to the quality and safety of dialysis patients, which
I
goes
love it.
along to what you're saying about the turnover and, staff training. So I actually
Right.
do wrote a ton of staff trainings too. So usually when I go
Okay.
places, I just tell them, like, yep, I can train your staff. And especially with assisted living places, I find that they are just
Hmm.
the most out of touch with taking care of dialysis patients in that, nursing home setting. So definitely just letting them know, like, I'm always, just trying to figure out new ways. I'm pulling, statistics at their surveys, see where they're going wrong, see where their education,
Right.
I'll move in, like, I can help you with this. You see this ding, you might not have got that ding had you took my class, and then she went and did what she did, and then y'all would be good.
Right. Now you just mentioned something, and it's new for me. You said that you notice a huge lag at assisting living facilities. How is a person what is the difference? What is the lag that you're noticing for assisting living patients who are on dialysis versus someone living at home?
what I'm noticing is that the staff is not in tune to like the dialysis regimen. So yeah,
Okay.
you have the jug of water sitting at their bedside. Where, not to say they shouldn't have any, but it should, or they have bananas, and it's like, well, this isn't, and they're not measuring it or recording how much of it that they're eating. And I do notice an increase of, ER visits in assisted living places for, fluid overload, electrolyte imbalance, things like that. So really just educating them, like when you're taking care of a dialysis patient, it's not just like throwing a tray in front of
Right.
someone and,
Right.
you have to pay more attention to them. You have to check their sites. You have to make sure, you take that. Don't let them come in here 2 days later with that same bandage on, and they also need to be educated. What
Right.
if it does start bleeding? What do I need to do?
Right.
Maybe they need to be on some Q2, Q4 checks after treatment just to make sure they're not, just some safety things to put in place just to, for their safety.
Right. And and it's unfortunate that there is a lag, and it just sounds more like neglect than anything
Hmm.
else. But you mentioned bandages. I know that there's not a set time frame. I know for myself, after I have treatment, I try to keep the bandage on for a couple of hours because I still bleed thereafter. But what is the ideal time frame to keep your bandage on after dialysis?
We have always said like 4 to 6 hours, and like you said, some people can vary. Some people, yeah, you need to keep that on until tomorrow.
Right.
But usually that can be assessed, once again when when you're communicating with your nurse or with your tech, when your
Right.
nurse says, well, how, that happened on Monday and today's Wednesday, and you just ask them, how did it go, especially if they're new, like older, the vets, they're gonna just come out and tell you like, look, I don't know what's going on here. I probably need to go to the
Right.
access center. This thing is leaking. But new people don't know. So you
Yeah.
need to just let them know, like, okay, if that happens, you need to let me know. This is what you do. Like we would give people tourniquets. Like, okay, if that happens, tie it off above, hold. Just you just gotta give them the rundown. And I find that, like you said, with the high turnover, and it just seems like staffing units now, I know I feel like they're different than when I started. I feel
I'm
like they're
sure.
so different. So
I'm
it's like
sure.
I don't feel like patients are even getting that level of service, because it's not even just care, it's service. Like you're
Right.
working with,
Yeah.
you are serving,
Well, yeah.
and it's not seen that way anymore too much.
Well,
I'm not saying everyone, but
a lot.
yeah.
I'm in Georgia, and I've been on dialysis for a year. It made a year January 2nd, and it's been a lot.
Hmm.
So from your standpoint, say this is my first dialysis session, and we want
Hmm.
to say, for the sake of our viewers, um, what should a person new to dialysis expect when he or she gets to the clinic for their very first treatment? What should be the care that they are, so they know what to look for if it's not there?
Hmm. Hmm. Well, first, everyone should introduce themselves. I don't like when people come up to me and just start talking, and I don't know who
Right.
you are. I just feel like
Right.
that's rude. Like, introduce yourself, because I mean, because it's very intrusive, by design, of course, but it is. I mean, it's like, and a lot of people
Right.
like, well, they know what they're here for. True. That does not make them any less of a person, any less scared, any less anxious, any
Right.
less concerned. So, just a simple, hey, and I'm like, I'm happy, and they're probably looking at me like, who is she? But in the end, that would make you feel more comfortable than if somebody say, sit
Right.
down, give me your arm, because
Yes, ma'am.
that's what you hear. So, make sure the person introduces themselves, make sure they're explaining what they're doing. I don't know why. People they like, why is all going on? Okay, sure. They don't. So I feel like clarity, like they say, clarity is king for a whole lot of things, and it's also true here. Like just being clear, that can just avoid a lot of unnecessariness when you just are
Right.
clear and you're concise and you explain what you're doing. So I would say that pretty much would take care of it, because if the person
Okay.
is explaining to you what's going on, you know what's going on, and they also need to tell you what to expect on a treatment and what you might expect without scaring you, though. Because I always tell people, because you have those people that kind of know when they're going to pass out. You just have them people that get the deer in the headlights. So I always also tell my vets, watch out for them. Keep just,
Right.
sometimes your neighbors could save you sometimes because it just happens so fast. So it's like, it just, create that camaraderie and to introduce them to the people around them, just make them feel comfortable. So if you don't feel
Okay.
like that, then you need to, you know, I wouldn't say, like demand it, but just, I would just ask, so what's your name? What do you do? How long you been here? They'll just start
Right.
opening up to you or they'll get mad.
Right.
Either way, you'll get what you want.
So you encourage the person to ask questions of their tech
Yes.
and their nurses.
Yes.
Is it standard practice for the person to wash their arm, or is the alcohol and the betadine wipes enough for the arm to be cleaned for them to insert the needles?
I still think if they're able that you should, just do a general wash because, like the alcohol and the beta, where you're just going in circles and you're still hitting the same skin. So you want to make sure it's as clean as possible so
Okay.
that you're reducing, the risk as much as you can.
Okay. Um, so if you're having dialysis, make sure you wash your arm
Wash your
before
arm.
with soap and water.
Yes.
Wash your arm, then let them do the alcohol. What about listening for the was it the
The
brute
thrill
and
and
the
the
thrill?
bruit. You
Yeah,
feel the thrill and then you
and you
hear
hear
the
the
bruit.
brute, right? Should they check for that every time?
Yeah, I think, yeah, a lot of people usually check, in the every morning, like even if they're coming to treatment, because we've had people call a unit like, my arm isn't working, and that's because they checked, in the morning instead of just coming in and then we find out. I mean, and sometimes it happens. Sometimes, it could happen on the way, like it was fine and then not. But
Right.
yeah, that I think that's important because then when something is wrong, you're so used to listening that you can, because a lot of people that whistle is like, if you've not heard that whistle before, you're like, you thinking you're gonna hear like, and it's not all the
Right.
time so pronounced. But if you're
Right.
used to listening to your arm and then you say, that doesn't sound right, even if you
Right.
don't really know, you can just let us know. Like, I listened to it, it didn't sound right. And then that, of course, as a nurse and a tech, where our radar go up. Like, okay, now we
Right.
watching for venous
Right.
pressures, we watching for bleeding, we failing to see, how soft it is. So, that triggers, other things that is,
Right.
that adds quality to their, to their treatment and it's their safety. So
Okay. Miss Ebony, for those that are watching, how can they connect with you? Because I've had the pleasure of looking at your page and totally love what you're doing. But
oh,
how
thank
can they
you.
connect with you and stay abreast of all the wonderful things that you're doing for the CKD warriors and this community?
You can always reach me. I have a contact form on the website. Our website is www.lwapllc.com.
One more time, a
And
little slower. One more
oh,
time,
I'm
a
sorry.
little slower.
www.lwapllc.com. And on there we have a blog. We have some written, and then I've transitioned the blog into actually the podcast show notes. You can find our podcast, which is called A Kidney Connection, and that's everywhere you can listen to a podcast. We're on
Okay.
Google, Spotify, iTunes, Pocket Casts, Stitchers, all of that stuff.
Nice.
Um, and we're also on Facebook at LWAP Consulting and Instagram at LWAP Consulting. So I love, connecting with people. I frequently give, free 20, 30, 45 minute time. Sometimes it starts as a free 20-minute, session. We end up talking for an hour. So, it
Right.
just depends. But I like, it's not, of course, everybody is in a business to make a living. But my main concern is that, people can just at least get their initial questions answered. So I'm always, talking to people, we schedule a couple minutes to talk. If you just have, any questions or anything, you can also get the planner that's on the website, and it's also on
Okay.
Amazon. It's like one of the only dialysis planners on there. So if you just type in
Okay.
dialysis planner, it will come up.
Wonderful. Well, thank you so much for
No
taking time out of your
problem.
busy schedule
Thank you for
to just
having me.
stop by Sisters Against Kidney Disease. But before we leave, I at least want to give you a minute, just um, parting words, parting wisdom. The floor is yours, Miss Ebony.
Oh, thank you. So what I would say to any dialysis warrior is just keep going. It's just like anything. You're going to hit your bumps. You're going to have bruises. You're going to hit them barriers. the thing is just not to give up. And I feel like a lot of people, there's not enough trial and error these days. Like everything, what might work for me or what might work for, your neighbor, it's not always going to work for you, and vice versa.
Right.
Sometimes it is, sometimes it's not. But the goal is just to something out there will work for you. But if you
Right.
stop trying, you'll never find it. And and that's why, another reason why I'm here. Like seek help. Seek help. We'll work something out for you. It might be half of this and half of that, but we'll get it done. So just don't give up and just keep trying because you're worth it. You're worth it.
Right.
You're worth it.
Right. Right. Well, as a warrior, I just want to say thank you because it does help us to keep pushing, to keep
Mhm.
fighting when we know somebody sees us, not the
Mhm.
disease, not the
Mhm.
diagnosis, but you see the person. And to remind us, I'm a big advocate of still living and thriving. I tell
Yes.
people all the time, I'm going to kick butt on this journey. I refuse to allow kidney disease to rob me of my life. I had to
Mhm.
shift some things, but it didn't stop anything. So thank
Mhm.
you for not just being a nurse trying to collect a paycheck. Thank you
Mhm.
for seeing your patients as the person, not as the diagnosis, and not somebody just sitting in the chair, but still seeing life behind those eyes. Thank you for being somebody who cares. Thank you for having a heart. And it is my prayer that as you give out, God gives it back to you, that, living with a purpose becomes bigger than you could even imagine, that He will give you partnerships that will amaze you, and that He would open doors that no man can close. And that you would duplicate yourself, right? I think one of the biggest tests of a great leader is to be able to duplicate themselves and work themselves out of the position to train somebody else to take their legacy and push it forward. So thank you so much for all
No
that
problem.
you
Thank you.
do.
I receive all of that.
Yeah. And it is my prayer that we get to connect again as we are on this journey and making some strides for kidney disease, and also to stop people from becoming patients, right? That's the biggest
Yes.
goal, right? We want to
Yes.
educate and eradicate kidney disease.
Mhm.
We want no more
Mhm.
dialysis centers to be opened up,
That's
right? We
right.
want people
That's
to
right.
be wise and intentional about living well and preserving their kidney health
Mhm.
and just thriving.
Yeah.
Don't wait till you're sick. Be
Right.
healthy and be well and protect
Mhm.
that. So thank you for being a proponent for us. Thank you for making sure that this disease will no longer be the ninth silent killer, that we're going to just smash kidney disease. And
Yes.
we're sisters against this, and we're going to rise up and make sure that people are educated and they're well equipped to
Mhm.
stop this from becoming an epidemic in our community. So,
Yes.
Miss Ebony, you are phenomenal. It was my
Thank
honor and
you.
privilege getting to know you and speak with you. And I look forward to seeing what you're going to continue to do on this journey. And you're amazing. And
Thank you. Thank you.
thank you for just being a voice for those of us who are on this journey.
No
So,
problem. I'm here anytime you need me, on camera and off. Just let me
yes,
know what
ma'am.
you need.
Thank you. And I definitely love the idea of the care boxes. So definitely want to connect in that regard, getting something like that here in Georgia. So thank you so
No
much. And,
problem. No
you know,
problem.
and again, be amazing because you already are. And I like to always tell the people that watch that we are bigger than kidney disease. We are more
Yes.
than a diagnosis, and we are thriving on this journey, and that there's still so much life for us to live. And just because we are on this journey doesn't mean this is the end of our story. It's just a new chapter and a new beginning. And we have every right to be amazing. And kidney disease is just one little small pebble in this big pond. So thank you, Miss Ebony.
No
And I look
problem.
forward to connecting with you again. And thank you to everybody for tuning in to watching Sisters Against Kidney Disease. We will see you next week, Tuesday at 9 p.m. You all continue to be amazing. Have a good evening. Thank
Good
you, Miss Ebony.
night.
Good
No
night.
problem.
Good night. Thank you.
No problem.